How to do basic first aid for a child's injury. Imagine your child gets a small cut while playing or a bump after a fall. Knowing how to respond calmly and correctly can make a big difference in helping them feel safe and cared for. Let's walk through some simple, trusted steps to handle common injuries safely at home. Remember, always seek professional medical advice if you're unsure or if the injury is serious. First, stay calm. Children pick up on your feelings, so keeping a gentle, reassuring voice helps them stay calm too. Explain what you're doing in simple words, like, "We're going to take care of your cut so it doesn't get infected." Teaching children basic safety skills, like how to call for help and giving their full name and address, can also be helpful in emergencies. If your child has a cut or scrape, start by washing your hands thoroughly to prevent infection. Use a clean cloth or sterile gauze to gently press on the wound until the bleeding slows or stops. If bleeding is heavy or doesn't stop after several minutes, seek medical help immediately. Once the bleeding is controlled, rinse the wound with clean water to remove dirt and debris. Applying a small amount of antibiotic ointment can help prevent infection. Cover the wound with a sterile bandage or dressing, making sure it's not too tight. If the cut is deep, bleeding heavily, or if debris is embedded, or if the wound exposes bones or ligaments, it's important to see a healthcare professional promptly. For bruises or bumps, explain that these happen because of bleeding under the skin. Applying an ice pack wrapped in a cloth to the area for about 15 to 20 minutes can help reduce swelling and pain. Always check for signs of a head injury, such as vomiting, confusion, or changes in vision. If any of these occur, seek medical attention right away. In case of minor burns, run cool water over the area for 10 to 20 minutes. Do not use ice directly or apply greasy substances like butter, as these can worsen the injury. If a child's clothing catches fire, teach them to stop, drop, and roll to extinguish flames. For larger or deeper burns, especially on the face, hands, feet, or genitals, or if the burn covers a large area, seek emergency medical care immediately. If your child sprains or strains a limb, follow the R.I.C.E method. Rest the injured part, ice it to reduce swelling, compress with an elastic bandage but not too tight, and elevate above the level of the heart. Watch for severe pain, swelling, or inability to move or put weight on the limb. If these happen, see a doctor as soon as possible. Choking can be frightening. For a conscious infant, deliver gentle back blows between the shoulder blades and chest thrusts until the object is dislodged or the infant becomes unconscious. For older children, perform abdominal thrusts, also known as the Heimlich maneuver. If the child loses consciousness, begin CPR and call emergency services immediately. Splinters are common and easy to remove if done carefully. Wash your hands and the affected area first. Use sterilized tweezers to gently pull out the splinter in the same direction it entered. Clean the area again and apply an antiseptic and a bandage. For allergic reactions, mild symptoms like sneezing or a rash can often be managed with antihistamines, but always follow a healthcare provider's advice. If your child shows signs of a severe allergic reaction, such as difficulty breathing, swelling of the face or throat, or dizziness, use an epinephrine auto-injector if available and seek emergency medical help immediately. Always wash your hands before giving first aid to reduce the risk of infection. Use sterile materials like gauze, bandages, and tweezers. Know when to seek professional care. If a wound is deep or bleeding heavily, if there are signs of head injury or severe burns, suspected fractures, or serious allergic reactions. Teaching children age-appropriate first aid skills can empower them to stay calm and respond effectively in emergencies. Remember, when in doubt, consult a healthcare professional for personalized advice and treatment.